You try to make a phone call to a 22-year-old on their phone, they get upset. They don't want to talk to anybody on the phone. They want to text. You need to start looking at the ages on the intake forms when patients contact you. Many of them may just want a virtual exam, don't even want to come in. Hey there, everybody. It's Dr. Glenn Krieger here with another episode of Your 5-Minute Friday. Now, you've noticed I've started doing this in video. If you're listening to it, you can watch it too. But I'm trying to tie together some really good themes every month to go along with the speaker we're having at Orthopreneurs University. See, I'm bringing in some of the best and brightest minds to help us along in our practices. And I'm talking about things this month related to case acceptance because we got Tracy Martin at Orthopreneurs University. She's going to give a 5-hour course meant for TCs and for doctors to help you better understand the things that are going to go into case acceptance, particularly with some of the younger generations. So let's talk about that a little bit. Now, does your practice send out paperwork? I mean, legitimate paperwork. Do you have a new patient call your office on your landline? I hope that you're on VoIP. I hope you're using internet telephone system wherever you're able to. Save yourself tons of money, but that's another discussion for another time. But when your patients call you on your VoIP and your front desk answers the phone, are you sending out a folder? You remember the days, maybe you're old enough to remember the days where we were told to get a really nice customized folder to mail out to patients for new patient paperwork. And folders have their benefits, but for new patients, are you sending out actual paperwork? May not be the greatest idea, perhaps, but if you were dealing with an 80-year-old patient, maybe paper is what they want the most. But what about a 20-year-old, 22-year-old, has their first real full-time job, finally has money they can afford to spend on orthodontic treatment? How are you relating to that individual? Do you believe that the baby boomer and Gen Z process information the same way? Do you think you have a one-size-fits-all that's going to work for everybody? Does your TC need to adapt to deal with a 22-year-old in a way that maybe you're not dealing with the 45 or 55 or 65 or 75-year-old who comes in your practice? There is a difference based upon the age and technological savvy of the patients coming in that's going to help describe or drive how you're going to deal with them. And you need to have a plan for this. You need to have a technology plan. For instance, if you're my age, you're in your 50s, most folks, I'm a little different, don't mind getting a phone call. You try to make a phone call to a 22-year-old on their phone, they get upset. They don't want to talk to anybody on the phone. They want to text. So again, you need to start looking at the ages on the intake forms when patients contact you. Many of them may just want a virtual exam, don't even want to come in. So you have to tailor based upon the age of the individual. 30 years ago in practice, we did whatever we wanted to do. Everybody sort of related the same way. I know this can be crazy. There was no internet. I know it's crazy, right? So 30 years ago, there was no website. There was no internet. Everybody dealt with things one way at a time. But the one thing I want you to do, and I want you to think about when this is over today, is are you going to look at your patients' ages on the intake form and treat them differently to help drive everything towards better education, more comfort for them, technologically speaking, and a better outcome? Now, that's why I have Tracy Martin speaking at Orthopreneurs University. She's going to work with you and your TC, or just your TC, or just you, to learn about the things that help drive millennial buying patterns, because that's the part that's growing big time. If you're 38, 39 years old, you're probably a millennial, and you probably have kids who are now 10, 11, 12 years old. That's who we have to learn how to deal with, because they don't deal, just like we'll learn about Gen Z eventually, they don't deal the same way as Gen X or boomers or the forgotten generation, right? So again, take this course with Tracy Martin. I promise you will not be disappointed. I think you get like 90 days to watch it. And so you can watch it over and over again with your TC as a great resource. I've hired Tracy myself in my practice, and she's going to help you understand the generational differences between patients. So go to orthopreneurs.com, go to look at Orthopreneurs University, and go click on the Tracy Martin link and go sign up now, all right? If you're watching this and there's another link associated with it, click on it. But I'm just telling you, if you're treating every age the same way, you're probably making a pretty big mistake, and you're probably leaving cases on the table, so to speak. So always reach out to me if you have any questions. I'm always here to help you any way I can. Much love to each and every one of you, and I can't wait to see you at the Tracy Martin course. Take care.